Okay, I'm going to share my screen. Okay, good afternoon, everyone. My name is Leo Perez. I work with Herb Scheck. He is the new agent of record for the group benefits. As you know, we are changing insurance carriers for January 1st, 2021 effective date. We have streamlined the benefits. Now we're going to be offering benefits with two companies, Aetna for the medical, dental, and vision, and the Hartford for your life, voluntary life, and voluntary disability benefits. It's going to be much easier to find providers now because you'll only be going to one site for your medical, dental, and vision versus 3 different sites, how you had in the past. Note that the new benefits will go into effect as of January 1st, 2021. So it's important to know that everyone's going to get a new ID card from Aetna if you enroll in the medical, dental, or vision. Make sure you advise your doctors or your providers that you're switching insurance carriers as of 1/1 so that they update their system. They're going to ask you for a copy of your ID card. It's important to do that because at times the receptionist or whoever handles the insurance, even though you tell your doctor, they might not update their system and they might send the claim to the prior insurance. And then once they get a denial, then they'll reach out to you and ask for payment. So you want to try to avoid that and let them know that, hey, we're switching insurance carriers as of 1/1. Now, I just want to make sure that everyone is able to see my screen that has the 2021 open enrollment overview. If you don't, you want to send me a quick message to chat. I'll have the chat window available. But any questions, let's try to leave them towards the end of the presentation. Or if it's something that you want to talk off table, we can do that as well. Yeah, I'll go ahead and do that right now.
When they print this, when they're done, I'm gonna
Okay.
link for it. I'll print it out.
So for January 1st, 2021, we're migrating the dental, vision, and medical benefits to Aetna. Aetna is a national carrier. And the great thing is that the medical benefits, the dental benefits, and the vision benefits all mirror your current medical benefits that you have right now with Florida Blue, IMED, and Solstice. So the plan designs are remaining the same, which is make it easier for you to make any changes or any updates to your medical, dental, or vision plan. Now, this is your open enrollment period. Your open enrollment period was in March last year. Now it's going to be in January of this year. So this is your time to make any changes. If you want to change plans, if you want to add a dependent, if you want to drop a dependent, because after this open enrollment period, the only other time that you'd be able to make any change throughout the year is if you have a qualifying event. Right? Qualifying event gives you a special enrollment period, special open enrollment period for 30 days, where you can make any changes to what you elect right now. A couple samples of those qualifying events are involuntary loss of other group coverage, if you have acquired new dependents through marriage, birth, or adoption, if you have a change in Medicaid or CHIP eligibility. And some of those other changes as well too are involuntary loss of other coverage, marriage or divorce, death of a dependent, or change of employment status. That's if you go from part-time to full-time and vice versa. Or if you become Medicare eligible. Medicare eligibility is also a qualifying event. So you have 30 days from when you can become Medicare eligible to either make changes to your current enrollment, or if you want to enroll in Medicare only, you could drop the group coverage and go on Medicare only. Now, it's important to know that any changes, you must notify HR within 30 days. There's an additional 60 days in case of Medicaid or CHIP eligibility. I'm going to answer all the questions to chat after the presentation. Just if you have any questions, yeah, just keep sending them, and I'll go through all those questions at the end of the presentation. Now, who can be covered? All employees who have worked at least 60 days of full-time employment are eligible for benefits on the first of the month following their 60 days of full-time employment. Now, that would only apply if there's any new hires that have been hired recently in the month of November, December. Everyone else, you're eligible as of today, as of right now. Now, I'm going to go over the high-level overview of the medical, dental, and vision plans, and you'll see, for those of you that are currently covered, it's going to be a summary of what you have right now, because the plans were mirrored to your current benefits. So for the medical, dental, and vision, they're going to be through Aetna right now. Aetna is a national insurance carrier. So one of the great benefits that you have on the medical plans, for those that were on the high deductible health HSA HMO, or the middle plan, the Blue Care HMO, those plans were limited to Florida only. With the Aetna plan, you have a national network of providers. So you have network providers in Florida and outside of Florida in all the 48 continental states. That's great if you're traveling outside of Florida and you need care. You have the peace of mind that if you enroll under one of the HMO plans, which we call them here EPO, you have access to in-network doctors outside of Florida. Now, I'm going to go over this plan on the right. This plan, the Aetna Open Access EPO, is the HSA compatible plan. So under this plan, it mirrors the same benefits you have for those that were enrolled on this plan. It's a $2,500 deductible individual, $5,000 deductible for family. It's important to note that you have family coverage. The family deductible has to be met first before the company pays their cost share, which is 90%. The 10% co-insurance is your responsibility after the deductible. That means the Aetna pays 10% of the contracted rate for any covered services. Now, your preventive care is covered at 100%. That's your annual wellness exam, including blood work. That's covered at 100% at no cost to you, including any other preventive services, right? After a certain age, it covers a cholesterol screening. It covers the well woman exam, your OBGYN visit. It covers mammograms. Anything that's considered preventive is covered 100% under all three plans. Just make sure that when you go get your annual physical, you're in top shape, because you want to make sure that the doctor, if you go for your annual visit and you tell the doctor, oh, by the way, I have an ache here or something hurts here, then it turns into a diagnostic visit and they might charge you a copay. So just make sure that when you go for your annual physical, including blood work, you're in top shape. Now, for those under the HSA plan, if you have your own HSA banking arrangement, you can keep that. As long as you enroll on the HSA compatible plan again, you can keep your HSA banking account where you can put money pre-tax and use it towards covered medical services. One great benefit with the Aetna plans, for those that elect under the HSA plan, is that the max out-of-pocket for family is reduced. $7,500. Under the Florida Blue plan currently in place, the family out of pocket is $10,000. So that there's a reduction there for those with family coverage. If you need medication, it follows the same copay level, $10 for generics, $50 for preferred brand, $80 for non-preferred brand after you meet your deductible. It's important to know that under the HSA compatible plan, since it gives you the option of opening an HSA banking account, everything is subject to deductible of $2,500 individual and $5,000 family. And then you have the benefit of having the cost share of 10% or the co-pays for your pharmacy. Notice that if you take any type of maintenance medication, you could have a 90-day supply filled through mail order, and you have the benefit of saving half a copay. Instead of going to your retail pharmacy and getting a 30-day supply, you can get a 90-day supply through mail order and pay 2.5 times the retail copay. Now, let me go over the HMO, the Aetna Open Access EPO. Now, this plan mirrors the same mid plan that you have with Florida Blue. It's a $1,500 deductible individual and a $4,500 family deductible. Now, you'll see that the deductible comes into play when you have any type of inpatient or outpatient admission or outpatient surgery. If you need to go see a primary care physician, you pay a $30 copay. Any specialist is a $55 copay. So it follows the same benefit structure that you have right now. If you need any type of outpatient diagnostic services outside your annual physical or annual blood work, you pay a flat $50 copay. If you have something life-threatening and you end up in the emergency room, you have a $250 copay. Notice that it says here, copay is waived if admitted. That means that if you end up in the emergency room and they tell you that they have to keep you in observation or they have to keep you overnight because you're too ill to be released that same day, then it turns into an inpatient hospital visit.
Por favor, tocar el botón naranja en la pantalla para un ticket de parqueo.
So the $250 copay for emergency room is if you go to the emergency room and you're released within 24 hours. Yes, Tracy. EPO means HMO, exclusive provider. That's just Aetna's name for the HMO networks. But the great thing is that similar to where your current plan is, the HMO plans are open access. There is no need to select a primary care doctor, and there's no need for referral to go see a specialist.
The orange button there, I gotta press it 5 times. 1 time. I did it already 5 times. Do it like that, 1 time, that's it. No.
I'm sorry, what was that again?
That's it.
Okay.
Everybody mute their phone, please.
Yeah, we're getting some background noise. If everyone can please mute their phones, and I'll answer any questions at the end of the presentation. If you need to go to the urgent care, it's a $60 copay. So just make sure that you know if it's something that's life-threatening, if you are lack of oxygen, if you have an elevated heartbeat, uncontrolled bleeding, please go to the emergency room. If it's something that can be taken care of at the urgent care, if you have a mild rash, if you have maybe a pinky that hurts, or you have a dislocated shoulder, a sore throat, if you can go to the urgent care, right now nowadays they can take care of a lot of those services that are not life-threatening, and they can prescribe any medication, and it'll be less costly to you because you'll pay a $60 copay versus $250 at the emergency room. Notice that for the pharmacy copays, I'm gonna go over that plan right now, Kimberly, the middle plan. For the pharmacy, it follows the same copay structure. You have a $10 copay for generic, $50 copay for preferred brand, and an $80 copay for non-preferred brand. If you take any type of maintenance medication, right, for example, for diabetes, cholesterol, or you can have blood pressure, you could have those medications filled through mail order for a 90-day supply, and you'll save half a copay instead of going to the retail pharmacy every 30 days. The max out of pocket on this plan mirrors your current plan, $4,500 for individual coverage, $9,000 for family. It's important to note that the out-of-pocket max for all three plans includes your deductible. It includes your deductible. It includes any copays you pay for any office visits. It includes any co-insurance, any cost share that you have with the insurance company. So it's all encompassing. That means that if for someone with individual coverage under this plan, if they pay $4,500 out of their own pocket for covered medical services in a calendar year, January 1st up to the end of December 31st, let's say if you meet your $4,500 out of pocket in June, any other covered medical services would be covered at 100% by Aetna, as long as you stay in network. Under the HMO plan, the only time that you would be covered out of network is for true emergencies. Because when you have a true emergency, you don't have the benefit of letting the doctors or the ENTs let them know, hey, take me to this facility or take me to this doctor because I have an HMO and you have to take me there. Emergency is going to be covered if it's in network, out of network. So those are the two HMO plans. Now I'm going to go over the point of service plan, which Aetna refers to the open access managed care plan here. So this plan here in the middle is a plan that mirrors your current point of service plan. I'm going to go over the in-network benefits first, and then go over how the out-of-network benefits work. So similar to your the Aetna HMOs, your out-of-pocket costs will be greatly reduced if you stay in network. Under the managed care plan or the point of service plan, you have a $1,000 deductible individual and a $3,000 deductible for family. You have a 20% cost share. That means that you're paying 20% of the contracted rate whenever you're admitted at the hospital or have any type of outpatient surgery. And the max out of pocket mirrors the HMO here, $4,500 individual, $9,000 for family. Under this plan, similar to all plans, preventive is covered 100%. The annual exam, blood work, all that's covered 100% with no cost to you. If you need to go see a primary care doctor, if you feel ill, you'll pay a $35 copay. If you need to go see a specialist, it's a $60 copay. Any type of laboratory work outside your preventive physical, you're paying $50 copay. Notice here on the emergency room, it's a $500 copay under the point of service plan. And it's gonna follow the same procedure as the HMO. If you go to the emergency room and they have to keep you at the hospital for at least 24 hours, then it turns into an inpatient visit. So the copay would be waived because then it will turn into a hospital visit, and you will be subject to the deductible first, and then 20% of the remaining balance, up to the max out of pocket of $4,500. Notice here, it's a much bigger impact if you go to the urgent care at a $65 copay than the emergency room. Then you have the same copay schedule for your medications of 10, 50, and 80. And if you do it through mail order, you'll save the benefit of half a copay. Now, with Aetna, since it's a national network of providers, it's very rare that you have to go out of network with the Aetna plan. But if you want the freedom to go see any doctor or even doctors that do not take any insurance at all, right? Then maybe this plan is the plan for you. But just note, when you go out of network, you lose the added convenience of having certain services covered at the copay level. The only service that would be covered at the copay level when you go out of network is the ER. Everything else, when you go out of network, you're paying the first $2,000 worth of covered services, and then you're paying 40% cost share. So your cost share is doubled when you go out of network. And your initial out-of-pocket cost, if you're an individual, it's $2,000. If you're a family, it's $6,000. So see that it's doubled the in-network amount. And it's important to know that when you go out of network, when you go see a doctor that does not take Aetna, or a doctor that does not take any insurance at all, those doctors do not have to honor any of the negotiated fees that Aetna has with their contracted providers. So let me give you an example. If you go see a specialist, right, where an in-network specialist, you know your cost would be $60 copay. If you go see a specialist that does not take any insurance at all, they may charge for that visit $300. Now, Aetna's going to say, hey, for that same specialist, we pay our contracted providers $150 for that visit. So Aetna saying, okay, so we'll cover the first $150, but that first $150 goes towards your deductible. So you're paying $150 of your deductible, but that specialist wants the full cost of the $300 because he doesn't have to honor the contracted rates with Aetna. So the difference of what Aetna would cover and what the doctor is charging is called balanced billing. It's important to know that when you go out of network, you're going to be subject to balanced billing because the doctor does not have to honor the contracted rates with Aetna. So for that specialist visit that he's charging $300, he expects the full payment. It's also important to know that any balanced bill amount does not count towards the out-of-pocket. So in the example that I gave, that specialist that's charging $300 for a visit, Aetna is only recognizing $150 of that visit, which you're paying all of it because your deductible is $2,000. You mean you're paying the first $2,000 worth of covered services. So even though you're paying $150, only the $150 counts towards your deductible and your out-of-pocket. The difference, the balance bill amount, does not count towards your deductible or the out-of-pocket. So it's important to know that, yes, under the point of service plan, you have the freedom to go see any doctor, but just know that when you stay in network, your costs will be greatly reduced, your out-of-pocket. Let me go quickly into the chat to see if there's any questions on the medical plan. Yes, we have a couple questions here. Okay, Patricia, yes, the open enrollment will end on December 21st, which is in a week and a half. Trisha, yes, the EPO equals the HMO, correct? Kimberly, yes, the point of service is the open access managed care plan. Yes, and for Tracy, correct. All three plans, the HSA compatible plan, the HMO, and then the point of service plan, all are open access, self-refer. There's no referral needed to go see a specialist. Christopher, the cost will be shown on the Viventium enrollment site. That we'll get instructions from Dina how to access the site so you make your open enrollment elections for this year. Stacy, so a point of service plan works in a similar fashion as a PPO. It's just it depends on how it's written with the insurance carriers with the state of Florida. So we refer to a point of service plan as a plan that's written on an HMO paper, but it has the out-of-network access. So it's similar to a PPO where you have in-network providers that your cost is greatly reduced, but then when you go out of network, you'll see that your out-of-pocket costs are much higher because you're paying for the full amount of those services up to your deductible amount. Now, I just want to reiterate that make sure that you're advising your doctors whenever you go visit them again that you're getting a new insurance carrier as of January 1st, 2021, and it's going to be Aetna. For those for you that under any of these plans, all three plans are open access. No referrals will be required. No referrals are needed to go see a specialist under these plans. Great question, Esther. So to find the providers under Aetna, let me quickly go into the Aetna site and go through the steps again. So to find a provider with Aetna, just go to aetna.com. You're going to scroll down and click on here where it says find a doctor. And then since you're a guest right now, since we don't have the plan information set up, you click on plan from an employer. You would enter a zip code. So here's where you select the plan depending on what you're looking for. If you're looking for a provider under the Aetna EPO or the HMO, you would scroll down under the open access plan. The open access plan, you would select the Elect Choice EPO for the HMO, or if you enroll on the point of service plan, you would select the Managed Choice POS. Those are the two networks under the medical plan. The EPO would be for the HSA compatible plan and the 1,500 deductible HMO. And then the point of service would be for the open access managed care plan without out-of-network access. For the dental plan and the vision, which I'm going to go over now, you would just scroll down and then for the vision plan, there's only one option, which is the Aetna Vision Preferred. And the great thing about the Aetna Vision Preferred plan is that it uses the same network that you have right now with iMed, sorry. So there's going to be no disruption under the Vision because it uses the same network of providers as your current iMed plan. For the dental, for those who are going to elect the dental HMO, it's this one, the DMO/DNO. And for those that will select the dental PPO, it's going to be the dental PPO/preferred dentist network with PPO2. That's a national network of providers under the PPO. So just know it's going to go to one single site for dental, vision, and medical, aetna.com. Let me go back here and quickly check the chat. Okay, yep, no referrals will be needed. Okay, I went over how to find the list of doctors, dentists, or optometrists. Okay, let me go to the dental portion. Oh, quickly here. For those that are enrolled on the HSA compatible plan, you can keep your current health savings account with any bank that you have. Yes, I will. So just make sure that for 2021, the contribution limits are a little bit higher. So it's 3,600 if you have single coverage, or 7,200 if you have family coverage. If you're age 55 or older and not enrolled in Medicare, you can contribute up to $1,000 annually in catch-up contributions in 2021. Just make sure that if you do have an HSA banking account, that if you want to continue to contribute towards that bank account tax pre-tax, you have to enroll under the HSA plan. Now, if you want to come off the HSA plan and enroll on a traditional plan, you can keep that money in your HSA bank account. You do not lose that money. Just make sure that you're using it for medical services only. Now with Aetna, we have the same two dental options that you have right now, similarly with Solstice. You have a dental HMO. Now with the dental HMO, you have to select a primary care dentist. If you do not have a primary care dentist in mind, right, one can be auto-assigned to you, and you can change it before the 15th of every month, and it will be effective on the 1st of the month following. Just make sure that with the dental HMO, it works the same way as your current HMO. You have a fee schedule for all covered services, and when you go to enroll, you'll have a link with that full fee schedule so you can compare cost. Under the Aetna PPO, you have the freedom to go to any dentist. Of course, your out-of-pocket costs will be greatly reduced if you stay in network. Under the Aetna PPO, the three categories of services are preventive, basic, and major. All preventive services, those are your annual cleanings, your exams, your x-rays, that's covered at 100% with no deductible. Any type of basic services, that's called your sample basic services, are a filling, if you have to take a minor extraction of a non-impacted tooth, that's going to be covered 90% after your deductible of individual of $50. If you have family coverage, each person has to meet $50 up to the max $150 family deductible. Any type of major services, those would be your crowns, your dentures, your root canals. The cost share is the insurance company pays 60%, and you pay 40% of the negotiated rate. Notice that the calendar year max benefit is $1,000 per member. So if you have a family of 3 or 4, it's going to be $1,000 per member. It's important to note too that since we're switching insurance carriers now, you can also double dip. If you have the dental PPO and you haven't used your full maximum benefit, you can use your current Solstice dental PPO plan through the end of December to take advantage if you have any outstanding dollars left under the PPO benefit. If you have the DHMO, it doesn't matter because you have a set copay schedule for all services. If you're under the PPO, I would take advantage and try to get any work done before the benefits expire on December 31st, and you get the new dental benefit under Aetna PPO. Now, under the PPO, you have the benefit of going outside the network for any dentist that does not take insurance or is not contracted with Aetna. All preventives covered 100% with no deductible. Now, for basic services, you notice that the cost share is slightly lower. So the cost share with Aetna is 80%, whereas if you stay network, they're paying a much higher cost share. your cost share here would be 10%. When you go out of network, it's 20%. For major services, your cost share is 40%. When you go outside the network, it's 50%. And similarly, with the way it works with a medical plan, when you go outside the network with the Aetna PPO plan, you may be subject to balanced billing. So for example, if you go to a non-contracted dentist for, let's say, some fillings, and that doctor charges, or that dentist charges, let's say $300 for 2 fillings. Aetna's going to come back and say, hey, for an in-network dentist for 2 fillings, we pay them $200. So Aetna's going to say, okay, so our contracted rate would be $200. We're gonna pay 80% of the contracted rate, right? So 80% of 200 is 160. So they'll pay 160, and you pay the difference. But that dentist is gonna want his full $300 because he doesn't have to honor any negotiated rates with Aetna. So you'll be paying the $40 plus the additional $100 that Aetna is not covering. So just make sure that if you can stay in network, it's going to give you the greatest savings. But know that if you have to go outside the network, if it's a dentist that you've seen in the past and you have a good rapport with them, you can even, if it's a dentist that does not take Aetna, but you've been a client with them, we've had in the past where some dentists will still honor the negotiated fees with Aetna just to keep you as a customer, and they will not balance bill you. So it's a conversation to have with your dentist. Let me quickly go into the chat. Okay. Okay. Tracy, okay, Tracy, I think I was going over the providers, but I'll go over it again. Yes, Heather, I'll go over again to find a provider after I go over the vision, so everyone can see it again. Richard, does major services include implants and dental plans? Let me double check that right now. I actually have the full summary. Here it is. Okay. Now, so under the dental PPO, implants are not covered. Right here. Brian, great question. So we anticipate we'll have at least temporary ID cards for everyone before the 1st if we get the complete enrollment file by the 22nd. That's why it's important that we're giving everyone a window up until the 21st to make any changes for the upcoming open enrollment period. Heather, yes. Yes, when you go on the portal to make your selection, you'll have links to the full summaries of benefits, so you make an informed decision. Now, the great thing is, like I said at the beginning, is that these medical, dental, and vision plans with Aetna mirror the same plans you have right now with Florida Blue, Solstice, and IMED. Hi, Giselle. Yes, great question. If you're not making any changes, yes, please, we still need you to make your open enrollment selection just to make sure that you want to continue the same plan that you have right now. Thank you. Let me go quickly into the vision, and then I'll go over how to find a provider again. With the Aetna vision, you get the same benefits that you have right now through IMED. you'd get the benefit of an exam once every 12 months at a $10 copay. It's important to know that similar to the Aetna Dental, if you have the vision exam right now and you haven't used it, please use it. Use it by the end of December 31st because you can actually double dip. You can get glasses or contact with your current provider, IMED, right? And if you need glasses or contact sooner than 12 months, you can get it under the Aetna because there's no crossover in benefits. Now, the vision plan works different than the dental and than the medical plan. With the vision plan, it's based on the last day of service. So if you have an exam, a vision exam, on January 5th of 2021, your next vision exam would be available in 12 months from that date. In that case, January 5th, 2022. Same thing for materials, which they consider contact lenses or glasses. You can get materials once every 12 months, and that's after you pay a $25 copay. It's important to know that the frames is the one benefit that you can get once every 24 months based on date of service. But if you have the vision exam right now through IMED and you haven't used it, you can use it now, and then you get Aetna frames at any time. So it's also important to know that the vision plan is for vision correctness. Any disease of the eye would be covered under your medical benefit through an ophthalmologist. Vision is if you can't see from near or far-sighted. Now, similar to your current plan, you have a national network of providers, independent optometrists, and also some national chains. But if you do happen to go out of network, which is very rare under the vision plan, you'll see that it gives you up to a certain amount of allowance for those certain services. If you need to have an exam, it covers up to $35 for that exam. And a comprehensive exam nowadays can cost you upwards up to $70, $80, or even $100. So when you stay in network, you have the benefit of knowing that the exam is going to be covered at a flat $10 copay. If you go out of network, the max it'll cover is $35. Same thing for materials. Now, under the materials for the lenses, that $25 copay is not cumulative. That means if you need trifocal lenses, you're not paying $25. You're paying a flat $25 fee for any materials. That includes the lenses and or the frames. Now, for the frames, it gives you up to $100 retail allowance. That means if you want frames that cost more than $120, you'll pay the difference, but you'll get a discount of 20% over the allowance. If you want to get contact lenses instead of glasses, it gives you up to $135 allowance towards contact lenses, and it gives you a 15% discount of the allowance amount. If it's medically necessary, right, they're covered in full after a $25 materials copay. Notice that if you go out of network, for the elective contacts, you get up to a $105 allowance, and for medically necessary, you get up to a $200 allowance. Now just remember that for the vision, it's for vision correctness. Any disease of the eye would be covered under the medical policy. And also it's important to know here that for the materials, you could get either or. You could get glasses or contact lenses. You can't get both in the same year. You can get, for example, you can get contact lenses on January 1st of 2021, and then next year you can get glasses because it's once every 12 months. And the frames you can replace once every 24 months because they expect you to take care of your frames. And if you need a new prescription, right, you have the benefit of having your lenses replaced once every year. Let me go quickly into the chat. I know there was some more questions popping up here. Okay, for Zorita. Okay, you're going to be making your open enrollment changes to the open enrollment portal through Viventium. Dina and myself are working getting that set up. So once it's ready, you'll have instructions on how to access the site. So you can go in there and make your open enrollment selections. For Tracy, yes, these plans, they're all standalone, meaning that if you select the dental HMO or if you select the medical PPO or point of service, right, you can pick and choose your plans. You do not have to select the same HMO plan across the board. For Giselle, when I was going on the medically necessary, I was referring to the contact lenses. For example, if your doctor recommends that you need those hard permeable contact lenses that are actually embedded into your eye, those are the medically necessary contacts, where it's not the daily wear or extended wear.
I have a student who tested yesterday, and she claimed that when she got to question 19, it truncated everything and put her back to the original. And she lost time with taking the test. So we were trying to figure out what happened.
I'm sorry, can you repeat that question? I couldn't quite hear it.
Yeah, her name is Martina Oliveira.
So what was Gina's question?
Please mute your phones.
Okay, I'm sorry. I thought that was for the presentation. Okay, so those are the three core benefits. Now, the next benefits are going to be offered through the Hartford. The Hartford will offer the same benefits that you have right now. It's a flat $10,000 for basic life insurance, right? Should God forbid anything happen to you, your loved ones will receive a flat $10,000 benefit for final expenses. That's a benefit that you're automatically be enrolled with, even if you waive any and all of the other coverages. Now, similarly, the Hartford is making available voluntary life and voluntary short-term and long-term disability. The great thing is that with the Hartford, the rates for the voluntary life and the disability are lower or just as competitive as your current with Sun Life. So some of you will see when we send you the enrollment form that your cost for the voluntary life or the long-term or short-term disability is going to be lower with the Hartford. Now, it's important to know that for the voluntary life, for the employee, the guarantee issue amount is $80,000. That means that if you want to select voluntary life greater than $80,000, right, you have to submit what they call evidence of insurability. It's a 1 to 2 page medical questionnaire that you have to submit if you want any amount over $80,000. Any amount under $80,000, it's guaranteed issue. That means that coverage will be placed with no medical questions asked. It's also important to know that the maximum amount of voluntary life that you can elect is 3 times your salary or $300,000, whichever is less. If you want to cover your spouse for voluntary coverage, you can do so, right? But your spouse cannot exceed 50% of what you elect. For example, if you want to select voluntary life insurance of $80,000, right? Your spouse can select up to 40, right? But here's the thing: the guarantee issue for your spouse is only $30,000. So if your spouse wants $40,000, she would have to complete, or he would have to complete, that evidence of insurability form. Now, she doesn't have to They don't have to elect 50%. That's the maximum amount. That's the max benefit. So if you want to select 80,000 for yourself and then do 30,000 for your spouse, there's going to be no questions asked. That coverage is going to be guaranteed issue and it'll be implemented. Now you can cover children, right? For any number of children, but the maximum benefit is $10,000 per child. Now, children are covered after 6 months, right? Any newborn up to 6 months, there is no coverage. So it's a flat amount up to $10,000 per child. For the voluntary and long-term disability, I'll send you the election form, which has the rates that you'll see. For those of you that are currently enrolled, you'll see that your cost to protect your paycheck should you be unable to work, it's going to be much lower than what you're paying now. And lastly here, on the Medicare Part D notice. So this is important for those employees that are Medicare eligible, but are still on the group plan. Now, Aetna, all 3 Aetna plans for the Medicare Part D, these plans are creditable, meaning that these plans would cover just as much as any standard Aetna Medicare plan. So if you're on the current group plan, and then if you want to enroll on Medicare, there is no penalty associated because these plans are creditable. Now, let me quickly go back to how to find a provider under the Aetna plan. Yes, Giselle, great question. For the voluntary life or the voluntary disability, we made it open enrollment feature. That means that everyone, right, can enroll up to the guarantee issue amount or for the disability with no medical questions. Teresa, there will be a form, but like I just explained to Giselle, we are doing the open enrollment for the voluntary life and disability. So you'll be able to enroll up to your guarantee issue amount with no medical questions. And similarly, for the disability, you can enroll now as if you were enrolling for the first time with no medical questions. And let me go quickly to the Aetna site again. So you can just type in Aetna.com. You want to scroll down to where it says find a doctor. Now for the find a doctor, it's for the medical, dental, or vision. It's one place to find any provider. I'll go through the steps and actually look for a doctor to make sure we're all aware and how to find one. Here you want to click under guest first. Once you have your member ID, you can actually register. But for now, if you want to look up providers now while you're deciding, you click on plan from an employer. You want to put in your location. You could do a higher radius of providers, but the standard is either 15 or 25 because, of course, when you seek care, you don't want to travel too far. So we'll keep it at 20 miles. So if I wanted to find a doctor under the HMO medical plan, I would go to Aetna Open Access Plan and select the Elect Choice EPO. Once I do that, I click Continue. And then here, I could find a provider by type, right? Or I could just type in a doctor name and it'll give me all the doctors with that last name around that radius. Go back here and do the same thing under the point of service, change plan. The point of service would be here. Let me try. So say when you see a check mark, that means that that doctor is in network, and you can see if she is a specialist. We'll do the same thing if you wanted to search for a dental DHMO. Go all the way down. The DMO is this one, DMO/DNO. You select continue. And you could just type in by last name. Let me try again. In this case, this particular dentist is not in network under the DHMO. Under the PPO, you want to make sure you select the dental PPO 2. So there's two options here. This is the broader network, the PPO 2. So back to that Dora. Okay, so we see that Dr. Dora Rodriguez is in network only under the PPO, not the DHMO in this particular case. And we will do the same thing for the vision. Vision, you only have one option. You can search by location. You could filter by a language spoken, if gender, any preference, and then you could print the list And you'll see it has some of those national retailers as well. The Target Opticals, the Pearl Vision, Lens Crafters, and many independent providers. Go back to here. Yep, great question, Zell. So as you all may know, Aetna and CVS merged last year. So Aetna's preferred pharmacy is CVS. You may also go to Publix or Sam's, but you cannot go to Walgreens. Trace, yes, for open access, that means that all three plans, the HMO, all three medical plans, so HMO and including the point of service, are self-referred. No referrals needed to go see a specialist. Natasha, if you want to opt out of the dental plan, you'll have the option to waive coverage, to waive any coverage, be it the medical, dental, or vision, through the online portal. If anyone wants to unmute their phones and ask any questions that hasn't been asked or via chat, please feel free that this is the time to do it in case there's any questions regarding any of the plans we went over, any concerns, any doubts.
Carl has a question.
I do have a what would be what's the cost to us for these new plans?
Yes, so the cost, you'll see it on the, when you go to the enrollment portal, and you see, since we were moving fast and trying to get this done for 1/1, I didn't have time to put the cost on here, but if I do, I'll go ahead and send it to Dina again so she can share this presentation and everyone has the cost in front of them here, and I'll put the cost here.
Okay, thank you.
And I assume we're going to get an email of some sort that gives us where the enrollment portal is?
Yes, the enrollment portal is going to be open from the 11th to the 21st. Gives you a good 10 days to look at the plans. But the great thing is that the plans mirror the same benefits you have right now. The only great thing is that we're going from 4 insurance providers, 4 or 5, to 2, Aetna and the Hartford. We have a couple more questions coming in on the chat. Okay, let me see. So Tracy, on the open access, so not sure I quite understand. So it's all 3 plans are open access. Yes. Okay, I think I understand now. Yeah. No, they're all open access plans. The HMO is what Aetna refers to the EPO, and then the managed care plan, they refer that to their point of service plan. It's just a different name that they use. Yeah, if you have any maintenance medication that you currently have through Walgreens, I'll go ahead and send you the paperwork that you can transfer that medication over to CVS. They use Caremark. There was a question about what the dependent age you can add children to the vision. So the dependent age, the federal standard is up to age 26 for dental and vision.
So you're saying that prescriptions that Walgreens currently fills, we will no longer be able to do?
Correct.
So is there a mail service if there's no CVS near you?
Yeah. There is a mail service through CVS, correct. And they have the same program. They deliver that medication at no cost. Stacy, the question, yeah, if you currently have any maintenance medications through CVS, yep, you can continue that same process. Just make sure that your doctor sends in that new script if it needs a new script, and also make sure that you provide the new updated insurance information. The enrollment portal is going to be done through Viventium. I'm working with Dina to finalize the enrollment portal, but we wanted to give everyone a high-level overview of the benefits and just explain to you that the benefits are pretty much the same benefits that you have right now with Florida Blue, Solstice, and IMED. There was one question on the out-of-pocket. How does the max out-of-pocket impact the out-of-network OMAC? Okay, let me go through that quickly here. Okay, let me quickly answer this question. What is the youngest age child dependent? There is no age limit for as in regards to being younger. There's only a max age limit for dependent, 26 for the dental and vision. Okay, so for Ms. Roberts here, or LaShawn, when you have if you enrolled on the point of service plan, so the way it works that if you achieve your max out of pocket, just know that the max out of pocket means that is the most that you're going to pay towards contracted rates that Aetna has. So for example, if you go out of network and you get to that $6,000 out of pocket on the point of service, right? Aetna is going to be paid for those remaining medical services that you obtain outside of the network at the Aetna contracted rate. So for example, if you reach that 6,000 threshold and you have to go to a specialist again, and that specialist is charging the same $300, Aetna's saying that, hey, for a specialist, an in-network specialist, our normal standard rate of our reimbursement is $150. So Aetna's going to pay the full $150. The balance of $150, which is the amount that they can bill you over and above what Aetna pays, any balance bill amount does not count towards out of pocket. So Aetna's paying 100% of a contracted rate as if that doctor was in network, but any balance bill amount is going to be your responsibility still. So it's important to know that the true out of pocket really comes into play when you stay in network, because those doctors that are not contracted or do not take any insurance, they do not have to honor the reimbursement rates with the insurance carriers. Yeah, a couple more questions. Okay, yeah. So LaShawn, yep. So just I explained, if you hit the max out of pocket and you go out of network, you will still have to pay the difference of what that provider is charging you and what Aetna is paying. Alicia, yes, you can still use Publix. So Tracy, and the out-of-pocket max, the out-of-pocket max is going to include the deductible in both scenarios. You have the in-network deductible and you have the in-network out-of-pocket max. So your in-network deductible $1,000 is included in this individual out-of-pocket. So if you end up in the hospital and you have to pay $1,000 because those services are subject to your deductible, right? This out-of-pocket max will be reduced to $3,500 because you've already paid $1,000 into that out-of-pocket, and everything else that you pay, co-pays and co-insurance, is chipping away at this out-of-pocket max. Liz, so there's two options that we've come across in the past when your doctor is not contracted with Aetna. You can let us know the doctor name, and we could have Aetna reach out to them to see if they're interested in becoming contracted. If you've been a patient with them for a while, most doctors, due to the current pandemic situation, are very open to honoring those rates that Aetna would pay, right? As long as you are enrolled on the point of service. Yeah, or the last resort would be to pay out of pocket. But whenever you pay out of pocket, right, and you don't go through the insurance, right, any amount that you pay out of pocket outside the insurance is not counting towards your out of pocket max. Esther, in regards to the in-network question for one plan versus all plans, if there's two networks you want to check, if they're under the Aetna EPO, right, they're going to be under both plans, the HSA option and the HMO 1500 option. You still want to double check if you're under the point of service, that those doctors are in network as well too. But similarly, the way we check for the dentist, there are certain doctors that are only contracted under the point of service and not necessarily the HMO. Tracy, let me see that question again. Does out of network go into in-network deductible? Okay, so Tracy, if you're referring to the point of service plan, so with a point of service plan, right, you have two buckets, the in-network and out of network. So both buckets are accumulated separately. If you pay $1,000, if you end up in a hospital in the Tri-County area, all major hospitals are in network. So if you end up in a hospital and you pay $1,000, right, your in network out of pocket is reduced by $1,000. It does not reduce your out of network deductible or your out of network max out of pocket, because since you're staying in network, it's applying to these buckets only. Whenever you go outside the network or you go to a non-contracted provider, then those services would chip away at the out of network deductible and the out of network out of pocket. So they do not cross accumulate under the point of service. Each one has its own separate bucket, in network and out of network. For Cottrell, the Aetna HMO plan is called the Aetna Open Access EPO. For Heather, yes, the Aetna Choice EPO, there's two options under the Aetna EPO plan for the HMO. You have the HSA compatible plan, where just know that the HSA, the way the benefits function is a bit different than a traditional plan. Where a traditional plan, you have certain services covered at a copay level before your deductible. Under the HSA plan, everything is going to be subject to your deductible first, because with the HSA plan, it gives you the option of opening up an HSA banking account and putting in pre-tax dollars that you could use towards medical services. If you're on one of these traditional plans, the HMO 1500 or the point of service 1000 plan, you cannot open an HSA banking account because you have first dollar coverage at most of these services at a copay level. Whereas under the HSA, you're paying for the full cost of those services up to your first $2,500 for individual and $5,000 for family. Heather, does that answer your question? I want to make sure.
I think so. It's just very confusing because the names you've got at the top of your columns don't relate to what we're looking at on the Aetna website when you're trying to find out if your doctor's going to be in Aetna.
Oh, okay. I see what you mean. Yeah. So for the for both this plan on the left, the Aetna Open Access EPO, right? When you go to the provider search.
Yeah, you got the Aetna Open Access plans, and it's Elect Choice EPO Open Access.
Yeah, they just list it backwards. That's what it is. So when you go find the plan here, you want to go to the Open Access plans, right? And these two options here.
Okay, so the first one is the first one in your grid, and the second, the Managed Choice, is the third one over in your columns.
No, the first one, the EPO, is for the HSA option and for the HMO option, 1,580%. And then the point of service, right, is for the plan that offers the out-of-network access. So EPO, just think of it, EPO is HMO.
Okay, so the EPO 1,500 is
so the EPO
that one there, the
1,500.
Elect Choice.
Yep, and also for the HSA plan.
Okay.
Yep. And then for the middle plan, it'd be this one, the point of service. Check. Any other questions? Feel free to unmute yourself or ask to the chat. So if there's no other questions, I'm going to stay on here for the next 5 minutes. Like I said, this session was recorded, so we'll make it available in case you want to go over it again. If you have any other concerns or questions, feel free to email them to Dina, and we'll get you the answers right away. Yep. Hey, LaShawn. I'm going to go ahead and send you over the process to have a doctor being nominated to come into the network, right? We can have Aetna reach out to them, or they can actually go on to the Aetna portal, and we'll list the steps so they can become contracted if they're interested. Just remember that for the medical plan, open access, no referrals needed. Make sure that you give your doctors a heads up that you are switching insurance carriers. If you want to make sure that you want to fill any medications towards the middle of December or end of December, just to make sure that you have ample supply on hand. We don't expect any disruptions in service because we're doing this, early. So we want to make sure that you make your selections at no later than the 21st.
Can you maybe post your and is it Adina's contact information? Because of course we are not familiar with your email addresses or anything.
Yeah, I'll send it over to Adina, and she'll send it to the department head, and then she can distribute that.
Okay.
The same way we did with the call. She'll distribute everything, so we have one point of contact. I'll keep the meeting on till 2:30 in case then there's any additional questions that come up, and then I'll stop the recording and then the presentation. I think we're about at half capacity from when we initially started, so.
Thank you for your time.
Oh, thank you, everyone, and appreciate everyone staying on mute, and
Yes, thank you.
very good questions. Yep, check. Someone has a question about dental out of pocket. Sure. Cottrell, you want to unmute yourself, or you want to send me the question via chat? It's perfectly up to you, whichever you prefer. I'm going to pull up the full summary for the dental PPO so you could see it. So fittings would be covered under basic services. That means that the insurance, Aetna, is going to pay 90% of the contracted rate, and you pay 10%. Under the dental plan, the out-of-pocket doesn't really come into play. Since Aetna, with the dental PPO plan, there's a max benefit that you get on an annual basis, and that's $1,000 worth of covered services. So once you've exhausted that $1,000 of covered services, right, then you're paying the contracted rate with those providers at 100%. Yeah, if you've exhausted your current annual max under your current PPO plan, I would recommend waiting to do any additional service, because if you've exhausted the 1,000 annual max, you're paying for that for those services at 100%. So if you can wait until January and then get a fresh new benefit, right, I would do that. And then on the contrary, if you haven't used your dental PPO plan, I'm pretty sure you'll start seeing in the ads or on TV saying, hey, yeah, come use your dental plan before it expires or before it resets. Yeah, we can look at maybe next year expanding the annual max, but we were trying to move everything so fast. What we did is that we kind of mirrored all the current benefits. so make it an easier transition for the new benefit period. Okay, I'll give it 3 more minutes. I think we have less than 10 people still on the call, but I'll stay on for the next 3 more minutes in case anyone has any additional questions or concerns. So I want to thank everyone, including those last few stragglers who are here with me to the end. Thank you all for your, for making the time and jumping on to this call. If you have any additional questions or concerns, please let Dina know or your department head know, and we'll get any concerns, squared away. And I did keep a list of all the chat questions and all the follow-ups that we have. So we'll send out additional information as well, so you can make an informed decision for the new open enrollment period starting 1/1/2021. See, at this time, I'm going to end the recording here.